Hi, and welcome to the 18th episode of our Healthcare Digest series. Today, we'll be providing an update on telehealth. My name is Laura Peth. I'm one of the principals of the Mazars Healthcare Consulting Practice, and joining me is Jennifer St. one of our managers. Today, we're going to be covering four main areas. First, the impact of COVID-19 on telehealth, as well as considerations for when implementing telehealth. Then we'll go over some of the most common requirements and laws and some leading practices for providers. One quick note before we get started. Today's discussion is focused on telehealth, which is a bit broader than telemedicine. Telemedicine is an interactive electronic exchange of medical information between a patient and a provider to improve a patient's health. Essentially, telemedicine is centered around a live patient and provider interaction taking place electronically, whereas telehealth can be used for a broader array of services, such as patient education, remote monitoring, prescriptions, nutrition counseling, wellness visits, management of chronic conditions, and mental health visits. So telemedicine is a part of and under the umbrella of telehealth. All right, let's get started by taking a look at the impact of the COVID-19 pandemic on telehealth. Use of telehealth surged during the pandemic, as many people already are aware, and it increased access to care when it was often not possible to be in person. Services for common mental health conditions surged 16 to 20-fold during the first year of the pandemic. And as of August 2022, audio-only telehealth visits accounted for 20% of primary care visits and 40% of mental health care visits at safety net clinics in the state of California, just to provide one example. The bottom line is that telehealth is here to stay. So what type of considerations should you keep in mind when implementing telehealth? Healthcare organizations need to consider the following important questions to assure the provision of telehealth is effective and to mitigate risk to both their own organization and their members or patients. What telehealth laws, regulations, and guidance exist? What telehealth best practices should you implement? How can your organization assure quality care is provided through telehealth? And are current fraud, waste, and abuse prevention processes adequate? We'll dive into a few of these questions later in today's Healthcare Digest. I'm going to hand it over to Jennifer now to review some of the requirements for providing telehealth.
As Laura mentioned earlier, the COVID-19 public health emergency had a significant impact on telehealth. The less stringent rules, which allowed healthcare providers to use any available non-public facing remote communication technology for telehealth, even when those technologies may not have fully complied with HIPAA rules, ended on May 11th, when the public health emergency ended. Now, telehealth, including audio-only services, is still permitted under HIPAA, even though the PHE has ended. However, all telehealth services, including audio only, must comply with HIPAA rules. Healthcare providers must take reasonable measures to ensure telehealth services are offered in a private setting. Providers must implement reasonable safeguards, such as using lowered voices and not using speakerphone, to limit the incidental uses or disclosures of PHI. What providers need to know. If you're going to continue to offer telehealth services now that the PHE has ended, you need to be aware that there are three types of telehealth. Asynchronous, which is communication or information that is shared between providers, patients, and caregivers that occur at different points in time. There's synchronous, which is that live interaction between the provider and a patient. And remote patient monitoring. This is the transmission of patient data to the provider through a home device or information that is entered and transmitted electronically by the patient. Remote patient monitoring can occur from a device such as blood pressure monitors, continuous glucose monitors, insulin pumps, pacemakers, etc. The key difference between asynchronous and remote patient monitoring is that remote patient monitoring, the data originates from either the home device or the patient and then transmitted at a later time to the provider. It's important to know that all state Medicaid programs reimburse for some type of synchronous service, but the reimbursement for the various types of telehealth vary by state, and we will go over a few of those caveats later on in this presentation. It is also important to note that there are two types of parity that are required for telehealth. The first one is coverage. So the same service that is covered via telehealth must also be covered as in-person. And payment parity. So if the same appointment done via telehealth would be reimbursed at the same rate if it was done in person. Now that the public health emergency has ended, there are a few changes that are permanent to telehealth. These changes come to us from the Consolidation Appropriations Act, which was passed during the public health emergency. Under this act, there are several different titles that implement more permanent changes than others. Title I, for example, is the improvement of rural health and telehealth. This specifically requires the VA to develop a strategic plan to ensure effectiveness of telehealth services provided to veterans. Title IV of the same act is the title that allows Medicare beneficiaries to continue to receive telehealth services at any site, regardless of type or location, until December 31st, 2024. This same section of the CAA also provides funds for fiscal year 2023 for CMS to conduct a study on program integrity related to Medicare telehealth services, including the effects of telehealth. So CMS has been allowed under this act to conduct a study over the next 2 years to truly identify the value and impact of telehealth and determine its continued use, potentially past December of 2024. Now that the public health emergency has ended, these next few points are the new telehealth requirements that are still permitted under the Consolidation Appropriations Act until December 2024, as it stands today. Under this act, for Medicare and Medicaid across the United States, federally qualified healthcare centers and rural healthcare centers can operate as a distant site provider for behavioral and mental health telehealth services. This allows Medicare and Medicaid patients to receive telehealth for behavioral and mental health in their own home. There are currently no geographic restrictions for the originating site for behavioral and mental health telehealth. And behavioral and mental health telehealth can be audio only. This also allows rural hospital emergency rooms to be behavioral and mental health telehealth originating sites. These are the provisions that are in effect as it stands right now for Medicare, Medicaid until December 31st, 2024. Now we're going to dive into some of the state caveats. For most Medicaid benefits, federal Medicaid law and regulation do not specifically address telehealth delivery methods or the criteria for implementation of telehealth. As a result, states have been given a lot of flexibility in designing the parameters of telehealth delivery methods to furnish these services. However, there are a couple federal laws which speak to Medicaid telehealth coverage. We just covered one, the Consolidations Appropriations Act. There are a couple of federal laws which speak to the delivery of Medicaid services that still apply to telehealth. For example, the healthcare provider performing the assessment must still meet the provider qualifications defined by the state. The individual must also receive appropriate support during the telehealth assessment, and the individual must also be provided the opportunity for an in-person assessment in lieu of the telemedicine visit. Albeit some state Medicaid programs, telehealth coverage is temporary until the end of December in 2024. And there are some states that have additional laws and flexibility with their telehealth, and some states only follow the federal regulations for telehealth, like Connecticut and New Hampshire. Some states specifically exclude provider types, such as optometrist or dentist, from telehealth coverage, while other states specifically include them. The location of originating site for telehealth coverage also varies by state. Some states specifically require the patient to be in their own home during the telehealth visit. Some states only cover telehealth in rural areas. Some states do not address location at all. Service type varies the most between states for services such as mental health, substance use disorder treatment, home health, and patient monitoring. Certain states specifically address and cover these services via telehealth, while others specifically exclude these services like home health and monitoring from telehealth coverage. Many states also specifically address the type of telehealth that is covered. Audio only is included by some states, and others only consider live video interaction to be telehealth. So that it is important, if you are going to offer telehealth services, that you look up your specific state laws and comply with those.
Thanks, Jennifer. Definitely important to know what laws and regulations apply to you, both at the federal and the state level. And it can also be dependent on the types of lines of business that are accepted. So if you're accepting federal dollars or if you're commercial, that can also make a big difference, right?
Absolutely. This was just an example of some of the state Medicaid laws and how different they can be.
Definitely.
Commercial always throws in another layer of complexity there, so it's very important that you look up your state laws and comply with those.
Excellent. Let's go ahead and take a look at some leading practices for providers and even for payers that are working with providers to use telehealth. So you've taken the steps that Jennifer just walked through to really understand which federal and state laws and regulations are applicable to you and your members or patients in the provision of telehealth. And you're either already providing telehealth or you're going to start doing it. What can we do to make sure that your telehealth services are effective, serving your patients or members well, and also providing high quality care? On the screen, I've summarized a few questions to consider, but I'm going to dive into a little bit more detail. Before offering telehealth services, your organization needs to make sure it can answer the following questions. How are you going to address potential technology challenges, both for patients and even your providers who may need technical assistance? How is your organization going to assess your patient population demographics to assure you're providing telehealth in a way that considers necessary cultural and linguistic services such as translation? How will you measure staff readiness and willingness to implement telehealth options in healthcare delivery? And this has to include staff beyond the provider. How are you going to train those staff members as well as your providers on that new technology and the accurate and complete documentation of services provided via telehealth to prevent inaccurate billing or fraud, waste, and abuse? How are you going to encourage staff and providers who might be reluctant to adopt new technology? How are patients going to sign in to their appointments? What's the user interface like for your patients or members, whether it's audio only or video conference? What mechanism are you going to provide that makes it easy and simple for your patients or members to immediately provide feedback on the healthcare services they received through telehealth? How will you assure and continuously monitor that your telehealth platform protects patient privacy and is HIPAA compliant. How are you going to incorporate telehealth into your existing compliance program and work plan? And how will your organization assess and monitor the quality of healthcare delivered through telehealth? Some suggestions on the quality front is to use what you already have. Grievances or complaints that might have quality issues, claims, PDRs, overturned denials. Review these processes now where you already pick up some of your quality information to assure there is a workflow by which telehealth issues are captured, detected, elevated appropriately, monitored, tracked, and trended, and reported through your existing committee structure, as well as to provider relations if that's part of your organization. And lastly, how are you going to incorporate telehealth into your existing anti-fraud, waste, and abuse program? When thinking through all of these questions, the most important thing to remember is the output has to have evidence. If you're going to do the work that is necessary to make sure the services you provide through telehealth are effective and responsive to your member or patient's needs, be sure that it produces evidence, logs, trends, quality committee minutes. If it is not in writing, it didn't happen, and all of your efforts will be for naught. So please make sure that your processes are expanded to incorporate telehealth and that it produces evidence that you are doing a good job monitoring the provision of telehealth by your providers. And with that, we're going to close. We could probably talk about telehealth for hours, but today's Healthcare Digest was really meant to just be an overview of what's been changing with some of the requirements given the end of the public health emergency and some considerations that you should keep in mind either to improve telehealth services you're already providing or to begin providing them. Because as we mentioned earlier in the Healthcare Digest, telehealth is definitely here to stay. Jennifer and I are both at your disposal if you'd ever like to reach out. We are happy to listen and provide any resources that we can to assist you. And lastly, we have some resources here for you, as well as sources to some of the information we summarized or provided today. Take a look. It's wonderful information to help you in providing telehealth. Well, Jennifer, I think we're done for today. Thanks everyone for taking the time to join us.
Thank you for joining us on this episode of Healthcare Digest Telehealth.